So I'm Sarah Teal. I'm the research director at Voices for Vermont's Children, also a doula. And Kit is here. She's the communications director at Voices, and she's saved the day today for me technologically, which I really appreciate. So let's see. Here we go with. Can you all see this? Okay, great. So I kind of just want to start by clarifying and honing in on some definitions and in terms of what we sort of are and aren't talking about today, because doulas it can be really big or it can be more specific in terms of like the scope that we're talking about. A lot of you have probably heard the term full spectrum doula, which covers really the entire range of reproductive possibilities in a person's life. So it would be support for any and all of those. We're not necessarily talking about that today, although in the direction that I'm heading, I think like we can consider that as a goal and as a model. But I really wanted to narrow it down today to what we're calling community doulas. And here I'm offering a definition from Health Connect 1 in a publication they put out in 2014. And it seemed to me to encapsulate what I want to talk about today. And I'm not going to read it because you all can read it, but the key points in here are culturally pertinent support, shared lived experience with the communities they serve, so actual community members. And also it's really important that here they're suggesting flipping the deficit-based approach, which is often encountered, to a strengths-based approach in relationship. And then I just lost my view of you all, which is sad. Okay, we're back. So this is some of the data that we often see about the impact of a doula. And I'm just going to say also, we're talking here about doula support that includes usually the birth periods, but also extends over a bigger perinatal time frame. It's postpartum support as well and prenatal support. But this is related to birth outcomes. And this is a really significant impact, obviously, across a range of situations. And I just want to be really clear that this % reduction is a risk reduction, not like an actual number reduction. So it's not like the number of cesareans would be reduced by 28%. It's the relative risk of having a cesarean gets reduced by 28%. If that, I'm happy to like send people total clarification on that if you want. So obviously really big impact. And what that just here's directly pulled from the Vermont vital stats, some quick stats. Here we would be looking over here at anesthesia. That would be, the pain medication epidurals. So just this is where you can find the actual numbers for what this looks like in Vermont. And also, so induction is included here. That was one of the outcomes. Prolonged labor tends to shorten labor to have dual support. And here also is just also from the vital stats reports, the page related to infant outcomes. And here you can see the NICU admissions, 374 in 2020 with 7.3% of births. And here is more data. There's so much data about this. Is Vermont specific to Medicaid coverage by race and ethnicity in Vermont over this span of time. And so you can see that there's definitely a difference in the makeup of Medicaid recipients, and a pretty stark difference in this category of inadequate prenatal care by race and ethnicity. This all comes from March of Dimes Parastats project. Inadequate care is also a pretty specific definition having to do with timing and number of visits. So it's objective. Low birth weight and cesareans. And I'm just going to go through this data quickly and just keep flipping because it's going somewhere else, so the data is not going to end up being really the point, but I wanted to share it. And here are a few quotes that have been, Voices has used them before in our published materials about doulas. Just reiterating that the research and data has seemed to suggest that it has an outsized impact on outcomes. So in terms of an intervention, very big impact, very low cost, right? And it's been named as a key component of respectful care by all of these organizations. Research also suggests that the strongest effects have been seen when this support is not a member of hospital staff nor a member of the birthing person's social network. So it's that like independent, somewhat removed, autonomous place that seems to matter too. Okay, so what I've just presented you with is like the rationale for doulas, and it's what we always hear about. Here is a big attempt at an explanation of the why. Like why would this work so well? And this comes from Rebecca Decker, who's a researcher and founded Evidence-Based Birth. So she's connecting all of these things and trying to really explain like how this is working, right? But I want to bring it back to here, which is a quote I just encountered from a new publication. Doulas, trained or community-based non-medical birth companions, can disrupt families' experiences of harm, mistreatment, and adverse health impacts by acting as a supporting voice for birthing people within the medical system while enhancing birthing people's feelings of agency, security, and respect. So more so than the data and research, what I really want to say is that this is the foundation of why I believe this is the foundation of why doula support matters, why it works. And I also think that it points to a further foundation that's a principle of doula care as we seek to expand access. I took this from an Instagram account, Birth Workers for Human Rights, thanks to Maria, which I shared with me. It's vital that doulas collectively agree to protect the autonomy of the relationship and role they have with each and every birthing person they serve. And this is just a further excerpt from that same doula. So she's really saying it's incumbent upon doulas. This is a principle of the work to identify the role their unique community requires them to undertake, commit to essential foundational work to meet that need, including self-reflection, education, skill building, peer support, mentoring, engaging with providers and facilities with perspective and respect for their role, and addressing self-care needs to ensure optimal health and role longevity. And so what I'm really wanting to emphasize is the accountability piece, and the accountability being to the birthing person and the family. And just to put it also in this context of reproductive justice, this is sort of the original definition of reproductive justice, reflecting, for one thing, of course, in the context of doulas, the space, the actual space in the birthing environment, where that bodily autonomy is obviously front and center, but it also has everything to do with relationships of power in every single day of life. And doulas can be seen as an entry point, or as a point of connection to shifting those relationships of power. So this is a brand new resource, and I just really wanted to highlight it because it was published about 2 weeks ago. And it really tends towards some things that are going in Vermont, because we do have ongoing proposals to try to expand access to doulas via Medicaid. This organization has been working with the community-based doula model as their core priority for quite a while. And the recommendations in here, I think, might be a good starting point for what we can look at in terms of how to connect a model that's based in reproductive justice and autonomy in relationship with like bigger infrastructures and systems that haven't always been able to prioritize that or have actively, worked against it. This is another resource that's very comprehensive, addressing all of the nationwide, state by state, and different models of expansion of doula services via Medicaid. And just in terms of numbers, thinking about like what this looks like, Medicaid covered about 2,200 births in 2020. And that's about 40% of all births in Vermont. So thinking about, the 5,000, it was 5,200 something births, I think, in 2020 total. And then this other 2,200 under Medicaid. So in terms of how many doulas we need to be really doing what we want to be doing, there's some calculations to be made there. And again, we're going to send these slides, so you don't need to write anything down or whatever, but these are the resources that I think are really great starting points for this conversation. And I'm going to stop my share now. And I think let's just open it up for a minute to any quick questions or clarifications, because I just went through a lot. And okay, so I think what I would like to do is turn it over to Maria Rossi. And Maria, you can just introduce yourself and who you are.
Sure, thanks. Can everybody hear me okay?
Yes.
Okay, great, thanks. So my name's Maria. I have Anna with me, and I've been a doula for about 12 years. And for the last 9 years, about 9 years ago, I started a program within Washington County Mental Health called the Doula Project. When we serve folks who have Medicaid assistance and who qualify for community mental health services. In the last couple of years, we've received a couple of different grants, federal grants that have come through the state, and then where we really aimed at expanding services to anybody who lives in Washington County to have a doula. And from that, we've created a group of doulas who also live in Washington County. And I would say we are community doulas. And I feel that I've probably only ever been a community doula. I was born here. I grew up in Washington County. I live here now. This is my community. And I feel really passionately about trying to get care to as many people who want it as possible. And, one of the things that Sarah asked me to kind of touch on today was talking about pathways to becoming a doula. Which there are so many, and in some ways it creates like wonderful opportunity, and in other ways it makes it very confusing when we have systems like Medicaid and hospital systems and mental health systems kind of coming in trying to make sense of what a doula is. It does make it adds layers of confusion, because there's no one agency that is like the best certifying agency or the most comprehensive or anything like that. And there's many, I think I have read once there was like over 300 certifying agencies in the US, and that's probably an underestimate, all which have different methods of becoming, quote, certified. And I want to be really transparent and say that in the time that I've been a doula, become a doula, to now, my views and feelings have morphed and changed about what certification means. And I don't believe in certification at this point in time. I do believe in really good support and education and training for folks. And I think that I've been certified through many different agencies, and none of which I thought were all that different from each other. It was more a matter of convenience at the time. And but certification creates a lot of barriers for community doulas in particular, and doesn't really give a lot back when you're talking about community doulas and in your community. That's not to say that there aren't educational and training responsibilities that doulas have ongoing. And I think as we think about moving forward and pushing for Medicaid coverage or other coverage, and I also want to be clear that I'm not convinced that Medicaid coverage is like some magic wand. I think that it's going to happen in one way or another, and it behooves those of us who are doulas or anybody who's doing the work to have a seat at the table and be having conversations about what works in our worlds and what we know works for us and the families that we're serving, and not letting those conversations come from people who haven't done the work or who haven't benefited from the work. So, you know, there's many different certifications that someone could, or trainings that someone could go through, and none of them are they may all claim to sort of like be the best or the most anything. And I think where the real richness comes in is like what your community needs and how can you be of service in your community. And there are lots of different ways that communities can create spaces and opportunities for doulas to learn from their community about the special situations that might be really prevalent there, and how they can best serve those families in their community. And some of those are universal, you know, learning about, say, like interpartner violence, right? Like we know that's a universal truth. That's a universal thing that happens in all communities. And there are some communities where things might be more specific to that community. Maybe that community really struggles with substance use and pregnancy. That's not to say that's specific, because that happens across communities, but there might be some pockets where it's much more prevalent than others. And it would be really important for a doula to understand how to serve pregnant folks who are in that community, who might be in recovery or actively using, and what that means in their community, because it does mean different things in different communities, depending on where you live. Being somebody who is in substance abuse treatment or in recovery in Vermont looks very different than other states, where there may not be as many resources, or there may be a lot of punitive actions. So that's just, you know, things for the doula to understand and to know. I don't know who on here is currently a doula. I would bet that many people come from a lot of different training backgrounds. I've met many doulas across the board from all different training organizations, and I really believe the ones that are providing the richest kind of care are ones who have been able to do that kind of work. And yeah, so that's my soapbox about that. I got more, don't worry. And I also really love, Sarah, that you guys kind of opened with the principles of the relationship to families, and really doing everything that we can to protect that relationship and to protect the autonomy of those relationships. At the same time, collaboration is super important, and I don't think it can be really even underestimated how tenuous and challenging that can be to balance the collaboration and the positive relationships that you want to have with everybody, right? Like with hospital staff and with midwives, home birth midwives, and with anybody else that you might be collaborating with in the community who are in a different system than you, or especially when they're in a different system than you. And also honoring that relationship with the family is like at the forefront always. And that can be a really delicate, a delicate tightrope sometimes. And it takes a lot of practice, really. I think more than anything else, it takes like a lot of practice, and it takes feedback from fellow doulas, or other people who may have walked that similar path, or other professions. Social work is one where people are often kind of like walking that same sort of path in different ways, and being able to get support and feedback from other people about that. And also, relationships are so important. They are really everything. And sometimes the more you develop a relationship with a provider, the more tricky it gets. And so that is just something that, just is like, and we have to know how to do that. And sometimes that means like messing it up sometimes and going back and doing it better the next time, just like everything else. And I think that, when we look about what's happened across the country, I think when, especially in the early days of Medicaid coverage, the states that really didn't have a great kickoff, a great response, a great utilization rate, really were the states where they kind of like over-managed the doulas and micromanaged what happened, and created a lot of loopholes for both doulas and families to access. And there was like a whole, I remember like years ago, I mean, I'm like when this first came out, I think, obstacles, like a lot of red tape. And like, I think it was in Michigan where they, it was this whole conversation that was happening like 8 or 9 years ago. And what held up the bill for so long was who was going to oversee doulas. And that was like something that I was talking to folks out there, and that was something that was like holding them up, was this idea of like who was going to oversee doulas. And they wanted doulas to be in OB offices, and then they wanted doulas to be overseen by a midwife. And I think that created a system within a system that people couldn't really participate in like real ways. And it wasn't really utilized for a long time. I think it's evolved since then, but I think that everything that, I hope that we can learn from a lot of those things as we move forward. And like, we actually have this really amazing opportunity. There's so few professions in which you get an opportunity to say, like, this is what we feel is going to work. Like, this is what we feel is best for us and best for families. Like, we don't have to do it in this, like really old school, I almost want to say like pre-pandemic way. Like, we don't have to do it like that. Like, we can create it ourselves, but it's going to take work on our end to continually define what does work for us, and be really clear about that. Yeah, I'll stop there. If anybody wants to like have a question or say a comment or anything. I see Amy has her hand up. I can't see everybody, I don't think, so yeah. I apologize. Oh, look.
Thanks, Maria. Could you say a little bit more when you were talking about the certification and you said that it can create barriers? Were you referring more to like barriers on behalf of the doula or on the community at large?
Well, that's a great question. I mean, I think both, depending on which angle you're looking at it through. I mean, certification, the traditional difficult for folks who, don't have that money to complete that. learning styles that if you don't fit, and I do think it has changed a little bit over the very, very recent years. Some organizations have come out and shifted things, but if you don't have a learning style, which is I'm going to pick up a book, I'm going to read it, and then I'm going to take a multiple choice exam, or I'm going to attend something in person, and then I'm going to, do this. I'm going to demonstrate my knowledge in this way. If you don't have like a traditional learning style, those might not work for you. And it doesn't mean that you don't know the material. It doesn't mean that you're not a good doula. It means that that type of learning doesn't work for you. And those traditional ways of certification haven't really taken those things into account. And it also is very costly. So the individual themselves has to front quite a bit of money, which really puts up barriers for the doulas, especially if we're talking about wanting to really support people of all walks of life and all socioeconomic groups to become doulas. It's really difficult if they can't even afford to attend a training. And there's not a lot in return. The certification organization doesn't really give a lot to the doulas, especially people who are community doulas, in return. I mean, you could attend a conference, but that's also and maybe you'd have great learning opportunities, also costly, also assumes that you can have transportation there. I remember when I was one of the certifications that I did, I've almost always worked in community doula work, specifically with Washington County Mental Health. And so the folks that we're working with, they're often facing pretty significant social issues and mental health issues. And one of the requirements of certification was to get 3 letters of recommendation from families. And I tried to push back because I felt like some of the people I'm working with don't really have good literacy. I certainly can't ask them when they can't even get their basic needs met if they can write me a letter. It just felt so inappropriate to be asking that of families who were in really dire situations and struggled with that anyway. And they really wouldn't let me. They were very difficult to work with on that. And that was really disheartening to me. And that was probably the time where I was like, wait a second, who is this for really? Because that doesn't really leave a lot of room for anyone except a certain type of person to be able to even get supports, let alone get certified.
Recertification.
And then the recertification again is very costly. And I'm not going to say you don't learn anything at those trainings. You certainly do. But the idea of trained and certification are 2 different things. Because you could go and get trained, but to be certified, you have to read the books and do the things and demonstrate that you know this, and sometimes take exams or quizzes, depending on which kind of doula work or other birth work you're doing, like childbirth education or something like that. It's all a little bit different, but similar.
Can I add?
And then also there is a lot of pressure on communities too.
Can I add a little bit to that, Maria, and a more philosophical track? So the credentialing of all kinds provides this gatekeeping function, which is actually the point of it, right? And to take this back to the principle, not only of community doulas knowing what their community needs, it's actually below that families and birthing people know what they need. And so to then have somebody saying, well, you need to be certified by DONA or CAPA, first of all, no list that anyone would put out would exclude those organizations. And yet, if you do those trainings, you won't necessarily have what you need to serve really any varied population. It tends to be just anyway. So, and those organizations have been criticized for what they lack in those areas of social justice and race equity, gender oppression. So, famously in Michigan, or maybe it was Minnesota, I never remember anymore, but among the first states they actually itemized organizations in their piece of legislation, not having consulted really anyone, and found out that, you know, all of these community doulas, who mostly were women of color, like they had all trained with other organizations. And it was just like a big embarrassing mistake. And so the point really, I think, needs to be competencies versus, you know, organizations come and go, but competencies matter. And it also matters that it's like a continuous process of making sure that the input about what's needed is actually coming from families and communities themselves. That's my little soapbox. Can you hear me? Okay. I'm gonna stop, and I'm wondering if I know that Greer Sargent, who is here, was prepared to speak, and I'm wondering, Greer, if you feel ready, if you want to do that now. Yeah? Okay. Well, I'll hand it over to Greer, and you can introduce yourself as well.
Thank you so much, Sarah. Can everybody hear me okay? Awesome. So hello, my name is Greer Sargent. I'm a birth and postpartum doula and childbirth educator as well. I would consider myself a community doula. I've been doing this work for about 4 years, and I was actually born and raised in Vermont. So my whole life has taken place within like a 25-mile radius that I am still within. So not only am I familiar with just a lot of the humans in this area, but also what life is like. And I started my love and passion for families as a nanny early in my teen years, and then knew that doula work was something I wanted to pursue. And I'm so glad that I did. Sarah has asked me to talk a little bit about the principles that are central to the work that I do. And I'm sharing from the experience of myself as someone who is self-employed through my own LLC. So I work for myself, I work directly for families, and I'm hopeful that if there's any other doulas that have a slightly different perspective because they have a different nature of employment or relationship that they share, so that everybody gets a full perspective. And thinking of the things that were really central, the first one goes a little bit to what Maria said, and that's that education is continually ongoing for me, and it is informed by the families that I work with. So, and that's a self-paced, self-directed thing. I am a certified doula. I have similar feelings to Maria on certification, but my learning is something that when families ask me questions, it implores me to go and learn more and continue to grow myself as a doula. And so the information that I have, the education that I have, is really built around what people in my direct community that I'm working with are asking for, about the hospital that we're going to, about things that directly correlate to their health, for example. So that's super important. Another principle of my work that's very important that Maria did talk about a little bit too is that I work for families. I don't work for the hospital. I don't work for, there's many different entities that may be at play in deciding the care for families. My interactions with families are purely for them. I don't have a vested interest in the outcomes of anything other than what the family is hopeful for. And that affects my work in a major way, because as I'm with them and as I'm supporting them, educating them prenatally, supporting them physically through their birth, with people postpartum, the information I give them isn't tilted to the perspective of a benefit for anything that I am affiliated with. And that directly serves families. Another piece that's really central to my work and is super important that I think is different than many other professionals is the amount of time investment with each family. So if I'm working with a family as a birth doula, which we're kind of talking about mostly here today, I spend at least 4 to 5 hours in person with each family before the birth, I'm on call for them, meaning that I am poised and ready for them to let me know when their baby will arrive. And that can be over the stretch of many weeks. And so there's a huge holding of space within my calendar and my world to be able to be there for these families, which I'm so glad that I am, but it's meaningful on our end as doulas, that time that is put in. And then coming to the birth, which can be anywhere from a few hours to sometimes up to days, and staying with them, or calling in a backup doula very rarely if the birth goes really long and I absolutely need sleep, but it's definitely exceeds that of a scheduled shift or something that has any sort of predictability. And then I do go visit families postpartum as well. In my practice, I often bring people a home cooked meal. I sit with them for at least 2 hours postpartum and talk about the birth. We process, I give them any connections to resources of support within the community, as this time is absolutely pivotal, and making sure that people don't feel as though they've been dropped. And that's the way many people feel in the traditional medical system, with the absence of postpartum support guiding them both for their emotional and physical well-being. And some families I stay with postpartum, and I do more structural shift-based work where I'm helping them in the adjustment to new baby, giving them relief so that they can sleep, eat, do all the things that are part of being a human being. And that's more postpartum work. But many families, and I think this is a really important part of what I do, the relationship is a continuous one. It doesn't have always a clear, cliff drop off. It's really something where I'm with them through pregnancy, I'm with them through the birth, and I'm continuing postpartum. And that continuity of care is very important when we look at the outcomes, and we know that doulas are very helpful to families in creating positive outcomes for them. And that has to do with the built relationship, and that has to do with the staying with and with the time commitment that goes into the families, and how much we become invested in them and truly care about their well-being. Another aspect that's really central to my work is maintaining a positive relationship with providers that work kind of on the periphery or directly with me. And so that can be people when I go into the hospital setting, and this can be both a challenge and many other things as a doula, going to the hospital. And Maria alluded to the fact that, getting to know providers better is helpful, but oftentimes it can be also hard to hold boundaries as well. And so being more well-known within the community, you have to constantly be holding space, because you work for the families, for what the families want, what they're hopeful for within the constraints and the culture of whatever place you're entering with them or whatever place you're directing them to. And so the way in which I interact with other professionals is really pivotal in how the family experiences care in that setting. I am not someone who speaks on behalf of my clients, but I am certainly someone who is there to help them find their voice and help them get more information about options and risks and benefits, things that aren't always presented to them initially. And asking more of providers and changing the pace of care is sometimes well received, but certainly doula has to be constantly aware of their impact and their role within the system for the family. Those are really the main things that come to my mind. I'm hopeful that if Maria or anybody else that's here as a doula has principles that are central, that they share too, because I know that all of us do this beautiful work in different ways. Thank you, Sarah, for having me.
Thanks, Greer. I want to speak to a couple things you said. I'm wondering if Nicole, are you still here?
I am still here.
Nicole. Nicole is the recipient. Hi. Nicole has to run in like 2 minutes, right? So I just wanted to, I know you said you might want to say a little
Yeah,
something.
I'd love to just add a voice to the discussion. I love what everybody has said so far. So my name's Nicole. This is Pearly. Pearly was delivered by Sarah like 14 months ago, and was a huge support to us before, during, and after birth. And I myself am a healthcare provider. I'm a physician assistant in primary care. So I just want to say that the care that we were given by Sarah was vital in preserving our dignity through the birthing process, because the medical system doesn't have that as a priority for birthing people. And as somebody who works in the healthcare system, I know kind of firsthand all of the challenges that go into actual patient-centered care, actually being able to take care of people and their needs and families. And I love what everybody has been saying about credentialing and kind of these systems that really end up being barriers to good services for families, as opposed to kind of helpful for families. And I think that community doulas are an incredibly important resource, and I don't think that their value can be really quantified that well. I think there's good data to support how important they are, but just really feel super passionate about how important doulas are, and through my personal experience, just really feel that strongly. So just wanted to say that. Thanks for having this discussion.
Thanks, Nicole. So good to see you. Hi, Pearlie. So yeah. So Greer, thank you so much. I just wanted to let her, because she said she had to zip off, but thank you so much for everything you shared. And do other people want to speak to some of that, or have questions or comments at this point?
I will say something.
Yeah.
I'm Dave. Sorry.
Dava, do you want to go first, and then
Sure. So I'm Dava Savio. I am the pre and postnatal program coordinator at the Family Room, which is a parent-child center in Burlington. And I've been a doula for over 20 years, I just realized. And I'm so, for the last couple of years working at the Family Room, this program, it's a postpartum, built around a postpartum doula framework. And it's felt like we're working a little bit in a vacuum. And so it's really nice to be starting to connect more with other birth workers all over Vermont. And I really look forward to more opportunities for sharing and learning together, and collaborating more. And even when I lived in Los Angeles, I was on a board of the Doulas of Southern California. And I hope that eventually there can be some organization or like community organization where we can just meet regularly and share what we're experiencing working with the families, because I think we all probably work with slightly different populations, and it's really nice to be able to connect and hear from other people. So I'm just really excited to be here with all of you, and you'll probably be getting emails from me.
That's great. Thank you. Yeah, it's the doing the work in isolation is very hard. And so, yeah, likewise, very much looking forward to having opportunities for birth workers to be connected. Do others have? We're a little early, and we could end early if nobody has anything else to share. Somebody else was about to speak, right? When you...
I would can everyone hear me? Okay, my name is Abby. Hi, Dava. I'm in my car right now, but I am a nurse with UVM Now Home Health and work in the maternal child health program. And also, like Dava said, just really appreciate connecting with others in the community. For sure, as others have said, it is very challenging to work within the system, and like as a medical provider, like there's even more, it's just hoops to jump through. And really what we all do want to do is just help support these families. So anyway, thank you. I just saw that like this webinar, we got it, and I was like, this sounds so interesting. And I am just so happy also just to hear about the work, Maria, you're doing, everyone is doing to just try to make this more accessible to more people. It's so cool. And I mean, even as a healthcare organization, like I can just see like referrals, like we all are important in different ways. The stuff that Dava does, Dava and our program often are working together, but just being connected, just we're all trying to serve the community, which is awesome. Anyway, thank you.
Thank you so much for saying all that. Yeah. Thanks for joining from your car.
For sure.
Commitment.
Mobile office.
Should we wrap it up? Do people feel, Maria and Greer, and do we all feel like we covered our ground?
I'd like to say a little bit of something about the data that you showed, Sarah, and that people talk about. And the data is super important. And in this day and age, you really can't do much of anything without data. And I think that sometimes what gets lost in the data is that providing the emotional support, which whether or not you consider yourself as a doula, a like mental health professional, that's what emotional support is. It's really about like our mental health. And everybody has a mental health. It's not, nobody is exempt from having mental health. Like we all have it. And so really what doulas are doing is providing an emotional and mental health that happens to have really great medical outcomes. And the reason that I think that that's really important for people to sort of think about is that doulas are not medical. And I know that's something that is said often, but I don't know that people always like stop and think about what they are. And so because for different reasons, I think it's important. I mean, I think that data, the sort of like side effect of data can sometimes be very reductionist, and it can make big assumptions about someone's experience, and their experience can often impact their mental health. And so for a very classic example would be in the case of a cesarean, and where the cesarean is captured data-wise as a cesarean, and that's quote, less ideal or even bad or something like that. And when in actuality, if somebody is supported well, supported with like love and support and wrapped up in all of those things, they may not be happy that it happened, but they're not going to necessarily, they're less likely to walk away from that as a traumatic experience that then gets sort of like, a part of themselves, as opposed to, so I think that is something that like we don't really talk about or hasn't been really talked about a lot I think I've talked about it a lot with doulas. I know that doulas have talked about it a lot, and not just doulas, like midwives know this, like other people know this, but talking about it on more of a like on a bigger scale, a more like macro level, because I think people get so sometimes trapped like the data story that they forget that there's like people behind stories and the data doesn't capture the story. And what we want people to walk away with as doulas is that that was an experience that I went through, that we don't want them to walk away from it being like, I couldn't do this without you. I mean, that's like a classic thing people say. And we don't really want people to truly feel that way. We want people to feel like, wow, I did this thing and I'm amazing. And look, all these things I can do. And like, I'm so happy that I had your support. Not that truly you couldn't have done it without me. Like, and that's like true empowerment. And so in that case, it doesn't really matter how the baby was born. It doesn't have to matter. I'm not saying it actually doesn't matter. It does for lots of reasons, and it matters very deeply to many people. But mattering and walking away with trauma like are two different things. Something can be less desired and be difficult to go through and isn't necessarily trauma that you take with you in your life. And I just want to throw that out there because I feel like we often shout the data from the rooftops because it is great, forgetting that there's like a whole other story behind it.
So important. Yeah, the data is important for getting funding, it seems. And, you know, but yet what matters is is relationship, and that there's some sort of there's a permanency, right, to the outcomes that go beyond what happens in that perinatal period. It, like, that empowerment can persist. It can fundamentally be changing. It can change things. Yeah, thanks for saying that. Kit, did you?
Sure. Yeah, I just wanted to, in wrapping up, share, I'm not sure how familiar all of you are with Voices for Vermont's Children, but we're focused on sort of equity and justice through systems change. And through that work, we address a variety of seemingly separate but intersecting issues. And this conversation today is actually part of a larger ongoing series that we've been offering. We have delved into reach up, paid family and medical leave. And in the next month, we're looking at a whole bunch of other issues, including ICWA, the Indian Child Welfare Act, the Office of Child Advocate, and Children's Voice, Youth Voice in Court. So if you're interested in joining future events, they're all free. They're all, for the most part, they're typically recorded. We share out resources and the recording within the week afterwards. I'll follow up and send out resources in the next couple of days, along with a survey, which is really helpful for us in terms of thinking about what kinds of conversations and issues might be important for us to dive into in the future in this framework. And then you can also, if you'd like to stay connected to our work, you can sign up for our mailing list here too. So I just wanted to put that out there before we close. And thank you again all so much for being here today.
Thank you. Thank you, Kat. And I'm going to put my email in the chat just in case people don't receive what they need after this or want to get connected to others. You can ask me to make those connections. So thank you everyone so much for being here. It's quite lovely, as I knew it would be. Okay. Have a great rest of your day.
Great.